Hello, doctor. I'm currently taking medication for high blood pressure, but even though I'm on 3 or 4 different meds, my numbers just aren't going down. What should I do?
When blood pressure doesn't improve even with multiple medications, there's a chance that sleep apnea is the hidden cause. You see, when breathing stops during sleep, it can overstimulate the sympathetic nervous system, making it easier for your blood pressure to rise. Specifically, during episodes of apnea, your body experiences a drop in oxygen, interprets it as a crisis, and activates your stress response. This leads to increased heart rate, tighter blood vessels, and the release of hormones that raise blood pressure. Plus, every time you stop and then suddenly resume breathing, your brain partially wakes up. That means your body never fully rests during the night, and your blood pressure stays elevated even into the morning.
I see. Normally, sleep is supposed to help you relax, but in this case, it's like your body's under constant stress while sleeping. No wonder the blood pressure doesn't go down. What should I be paying attention to specifically?
Let me explain how sleep apnea affects blood pressure using 5 key points. First, during the night, the sympathetic nervous system becomes overactive. Each time apnea occurs, the body senses a lack of oxygen and goes into crisis mode. As a result, your blood pressure tends to rise rather than fall during sleep.
Just imagining that makes me feel like my body isn't really getting any rest, even while I'm asleep.
That's exactly right. The second point is that sleep apnea often leads to nighttime or early morning spikes in blood pressure, what we call nocturnal hypertension or morning hypertension. If your blood pressure is unusually high when you wake up, sleep apnea could be one of the underlying reasons.
That makes sense. If my blood pressure is already high in the morning, I'll probably feel off all day.
The third point is its connection to treatment-resistant hypertension. When blood pressure remains high despite taking several medications, overstimulation of the sympathetic nervous system due to sleep apnea is often at the root of the problem. Without addressing the apnea, medications alone may not be enough to bring your blood pressure down.
That's really surprising. So unless I deal with the underlying cause, medication won't solve the issue?
Exactly. The fourth point is the increased risk of complications. Elevated nighttime blood pressure raises the risk of serious conditions like heart attacks and strokes. Sleep apnea can be a major factor in long-term damage to your blood vessels.
Just having high blood pressure is scary enough, and now I have to worry about heart and brain diseases on top of that. I really need to take this seriously.
And the fifth point is that CPAP therapy can help improve the situation. Using a special mask during sleep to deliver airflow prevents apnea, and many people see improvements in their nighttime and morning blood pressure. Several clinical studies have reported that CPAP is effective for managing hypertension.
I always thought CPAP sounded kind of extreme, but if it helps with blood pressure too, it might be worth a try.
It might feel like a big change at first, but most people adjust quickly and end up sleeping much better and feeling better overall. If you think this could apply to you, I recommend getting a proper sleep study done.
I think I will. Thank you so much, doctor. Now I understand that sleep apnea might be the hidden cause behind my high blood pressure.
You're always welcome. Let's take the time to identify the true cause and work together to find the most effective treatment for you.